It's not always easy or accessible to seek out professional mental health help. That's why Mental Health First Aid was created, to help those closest to us identify, understand, and respond when something feels off. David is a certified instructor here to share how important it is, this work that they are doing. Good morning.
Good morning.
Okay, so this is kind of a little tough subject, but
Right.
I kind of want to talk a little bit about what you guys do as a whole and how it's really made a difference here in our communities.
Right. Mental Health First Aid is actually a program that is designed to take individuals and say, how do I understand, identify, and respond to mental health challenges, substance use challenges? And then often, sometimes, what do I do within that crisis? Like, what if someone's going through a crisis? A friend of mine, a family member, a student, maybe a neighbor. Like, what do I do in that process? So Mental Health First Aid, think like CPR. Right? Could you imagine a world with no CPR?
Yeah.
Yeah, people are like, well, we'd have more dead people, but we learned two skills. The Heimlich maneuver, and then our little staying alive, there it is.
That's what
and from the yes. And so I would say that if we can learn these skills on how to identify what are we looking for, signs, symptoms, risk factors, and protective factors, how do we alleviate some of those situations and provide early intervention for these individuals?
So what kind of things do people learn during the mental health
during that training?
Yeah, during the training.
Yeah, so they're going to learn a variety of topics around how to identify what a disorder would look like or a mental health challenge would look like.
That's good.
They're going to also identify, like, what do I do in those situations? One of the greatest skill sets they'll learn is listening. Just how do we listen?
Listening.
There you go.
That's what it is.
And I think more often than not, people don't realize how much listening in itself is probably the most healing process. And so we talk about what is we call it non-judgmental listening. They'll learn a plan. It's called the ALGE plan. Like, how do we actively work through and assess, is this a crisis or not? How do we give reassurance and information and encourage appropriate professional help, or even encourage self-help? Like, sometimes it's not everybody has to see a therapist. Sometimes we just need a little bit of a skill. Like, how do I use a coping skill to navigate challenges like that?
Yeah, I like that. So who do you think should be taking these mental health first aid classes?
Anybody that interacts with anyone.
Yeah,
I think
people,
right? Especially with those that interact with individuals within their workspaces, businesses, whether they do it at school. If you have neighbors, you have family members. If you are a living human being, I think taking a mental health first aid is essential to us interrelating with one another, but also being able to provide early intervention. Most mental health challenges develop within adolescence. But it takes a while before someone will go and get help. And so if we can early intervene during those times and see that as somebody that we're looking for those things, I think anybody should be taking this training.
David, do you feel comfortable sharing why you joined with Mental Health First Aid?
Oh, yeah. And so this is I always tell people I got involved accidentally on purpose. Like, nobody signed up to go and have these hard discussions. But I was impacted in 2016 when we had 10 students die by suicide in our community. And there was a coalition that was formed, and one of the resources people were talking about was Mental Health First Aid.
Yeah.
And I said, let me go get trained. And there's a program that is a product that equips adults to work with young people in this process. And so I went and got trained in that and started training people. About in 18 months, trained close to 750 people myself with some other partners in the community, and really worked through that process. And so now I have over 100 trainings that I've done myself throughout the state, and then primarily here in El Paso County. So much so that 2024, I got this piece of paper, you know how they get them, and that recognized me as I trained the most individuals in mental health first aid in the state of Colorado. And so that's how I got involved, and that's where it's kind of led me down.
How can people maybe get involved locally right here in SoCo?
Yeah, so there's a lot of things that you could do. Pikes Peak Suicide Prevention Partnership, or what we're now calling Suicide Prevention Partnership. Okay. You can get online, sign up there. You can look for the registration for those or ask for inquiries to do that. Schools are hosting these on a regular basis. Diversus Health has some right now. Like, you can get on. They have some training classes. They have a youth one and an adult one going on right now in the month of June. We can do this throughout the entire city. Get on mentalhealthfirstaid.org. You'll see where those are at.
May is Mental Health Awareness Month, so this is the perfect time for you guys to be researching all of this, seeing what resources are out there and available for you. Make sure you visit that website that you see on your screen right there. And if you know somebody who is looking to get immediate help, call or text the Colorado Mental Health Line using the number 988. A special thank you to the Suicide Prevention Partnership for bringing us this segment for Mental Health Week. David, always a pleasure.
Thank you.